A high-risk breast program is a clinic that's designed for women that are at an elevated lifetime risk of developing breast cancer. Our goal with our clinic is to educate people on why they have that risk and what are their options to help manage that risk.
In the high-risk breast clinic, we offer preventative strategies such as lifestyle modifications, even medications that can lower your risk of breast cancer. We also offer surgeries to lower your risk of breast cancer and give you a lot of the education that you need to make decisions about your health.
Well, in 2019, when it was found out I had cancer, it was quite a shock for myself and my family. We didn't actually have cancer before in my family, so I'm the first person to get it. I had radical surgery with ovarian cancer. I had over 100 tumors in my belly. I had 12 inches of colon removed. I had my appendix, my gallbladder removed. I mean, it was quite extensive. Part of that was genetic testing for the organs and the tumors that they took out. What they found is that I am genetically predisposed for ovarian cancer. Where it came from, we don't know because I really couldn't trace it back in my family. We just know that I am genetically predisposed with the BRCA2 gene. That it puts you at very high risk for ovarian cancer, breast cancer, and skin cancer.
So many people would ask, why have a high-risk breast program? Many people do not realize that there are certain factors that make a person a higher risk of developing breast cancer. Certainly family history of breast or ovarian cancer, genetic mutations, things like that could put you at high risk. And so in our clinic, what we do is assess each individual to determine whether or not you really are at high risk. And then if you are, we want to perform clinical exams every 6 months instead of yearly with your primary care physician.
Breast imaging is a vital part of high-risk care for women. Most commonly, women who are at high risk for breast cancer do need annual, every year screening mammograms, as they are known to detect the most breast cancers and save the most lives. However, we also add additional imaging to those patients. Most commonly, that's breast MRI screening, and that would be done every year. Breast MRI is a very advanced technology that we have here that's able to detect additional cancers in women who are at high risk for breast cancer. And that allows us to detect a smaller cancer earlier when it's treatable and curable, which is our main goal here.
So our approach to breast care clinic is not to just limit to imaging or medical specialties. We're trying to combine the emotional aspect as well as lifestyle changes in conjunction with medical specialties to make sure that we provide the best care for the patient.
So the resources that we have available in our high-risk clinic include radiologists that help us make sure we're using the most up-to-date imaging recommendations for you with your risk factors, genetic counselors who are highly trained in the variety of different testing that's necessary. We have a designated care coordinator who will ensure that your appointments are done on time, that your imaging is coordinated so that you don't have to worry about making sure orders are in. We take care of all that to make sure it's a seamless fit for you in our clinic.
Together, we tailor a care plan that is fit to the patient's individual needs. These might include wellness goals or changing their lifestyle to be more healthy.
We are located in 4 different locations: Boise, Nampa, Ontario, and Baker City. And so you never have to travel far to be able to see a specialist.
So women that would qualify for being in our high-risk breast clinic are women that have a family history of breast cancer or ovarian cancer. Breast and ovarian cancer can be linked with a breast cancer gene. Women that have been identified to have a breast cancer gene, something like a BRCA1 or 2 mutation. Women that have a prior history of something like Hodgkin's lymphoma, where they might have received radiation treatment to their chest, that actually puts them at a higher risk for developing breast cancer. And if you've had a history of a biopsy that might have been atypical, something like atypical ductal hyperplasia or lobular carcinoma in situ, are broad strokes of kind of women that would qualify.
We have certain lifestyle modifications that can lower your risk of breast cancer. We have medications that you can actually take that will lower your risk of breast cancer. And we actually offer surgeries that can actually lower your risk of breast cancer as well.
Take care of your health, but most importantly, recognize that there are things that you can do to test for not only just your baseline levels, but there's steps that you can take to move that forward.
I think I'm in a unique position of being a surgeon that treats breast cancer, but also being a survivor of breast cancer, knowing the emotional impact that that diagnosis comes with, and being able to connect with my patients in not only a clinical manner, but also in an emotional manner, and someone who's been there and understands what you're going through. And I really wanted to be able to convey that to my patients and let them know that not only have I been there, but I've got your back.
Why did I get cancer? We can always say that. Why did I get cancer? You know, nobody else in the family. Why did I get cancer? I like to rephrase it and say, where do I go from here? And my thing is, let's raise awareness on how we can prevent cancer. It's not just treatment and recovery that's important in this cancer journey. It's also prevention and early detection.
Sometimes people going in for a mammogram can be pretty nervous, and then especially if you've got a family history, your mom or your grandma had breast cancer, there can be a lot of anxiety about going in for mammograms. Our goal is to work with you to explain all of that so that you're not alone going through this process, and have a good support team to help answer all your questions and make you feel like you've got a good safety net around you.
We can take charge. We can take charge of our own health. Idaho is extremely blessed to have an incredible physicians and doctors and access to physicians. Let's take advantage of that. I've made a significant difference in our family, so that's my why. Why did I get cancer? To protect and save my family. We all can do more to help prevent cancer and stop cancer in its tracks.